What can you do when you cannot tolerate Sinemet, regular Carbidopa, Levodopa, whether it is due to GI side effects, such as nausea, or because your blood pressure drops and you feel lightheadedness or dizzy, or because you have sleepiness? I will give you options step by step to try before giving up. The first thing I have to tell you is that approximately 20 to 30% of the patient, when they start Carbidopa, Levodopa, the Sinemet, they have nausea, they feel nauseated. Usually goes away in a few days, but approximately 10% of the patient cannot tolerate the Sinemet, so you have to do something about it. The first thing that you have to do is start the medication correctly. How do you do it? So you always start a low dose. When I say a low dose, typically the doses that we use is 25/100 milligrams. So you start half tablet twice or three times a day after food. So you eat something and you take half of the tablet. Okay? Twice or three times a day. And after a few weeks, you increase to one tablet twice or three times a day. Usually three times a day, which is usually the minimal therapeutic doses. But I have some patients taking half tablet three times a day as well. The other factor, very important, is make sure that you are getting 25 milligrams of Carbidopa, not 10. So, and why I'm saying that, because in US, at least in US, you have two options. You have the option of taking 10/100 and 25/100. There are other options too, but this is the most common one. And the important about this is the 10 milligrams or the 25 is the doses of Carbidopa, which is the helper of the Levodopa in order to work well. You need at least 75 milligrams of Carbidopa per day for Levodopa to work well. So imagine that you are taking the 10/100 and you take this medication three times a day. Basically, you are taking 30 milligrams, which is not enough. Remember, I told you that you need at least 75 milligrams of Carbidopa per day for the Levodopa to work well. So make sure that you start with the correct pill. Now, imagine that you cannot tolerate Sinemet, Carbidopa, Levodopa. Well, I will give you steps. Step number one. If the main problem is nausea, you feel sick, you feel nauseated, add more Carbidopa. Remember what I told you, that this pill combines Carbidopa, which is the helper. When I say the helper, is the medication that allow you to absorb the levodopa correctly. So if you don't use the Carbidopa, the levodopa will cause a lot of nausea and also help for the levodopa to penetrate a barrier that we have in the brain and also improve the absorption in the GI tract as well. So very important that you take the correct dose, which is 25 milligrams/100. Start with the correct dose, as I mentioned before. And if you have significant amount of nausea, even taking the 25/100, you might ask your doctor to add 25 more of Carbidopa extra. So you potentially can decrease the probability of having nausea. That's step number one. Step number two, if the problem, like I say, is nausea, which is the most common side effect, you can take what we call in US Sofran or ondansetron, which you are going to see here in the screen. So this is a medication that we use for nausea and is not contraindicated in the setting of Parkinson's disease. Remember, there are many medications that we use for nausea that block dopamine, and those medications are contraindicated, or at least relatively contraindicated, in the setting of Parkinson's disease. So, but Zofran, no. Zofran, you can take Zofran if you have Parkinson's disease. So what I tell patients sometimes is pre-medicate. So which means that take Zofran 4 milligrams 30 minutes before the Sinemet. And that might help for us. You can try this at least during the first few weeks if you're having this problem. But if you continue having the nausea, you might need to change the plan, okay? Because you are not going to keep taking Zofran every day. So if you live in Canada or Latin America and you are able to get something that we call domperidone, and you will see this in the screen. This is a medication that you can use as well in setting of Parkinson's disease, even though that is a dopamine blocker agent. But this one, particularly this one, doesn't cause significant Parkinsonism or make the symptoms of Parkinson worse. So this is a medication that you can use if you live in Canada or Latin America, but make sure, and this is the problem, that's why this medication is not available here in US, because this medication might cause cardiac arrhythmias. So make sure that you don't have what we call in medical terms QT prolongation. So you have that, this medication is not good for you, especially if you are taking other medication that might also prolong the QT interval or segment. Step number 3, if you feel bloated, if you feel abdominal fullness, nauseated, and you cannot tolerate the levodopa, one thing that you can ask your doctor is to check for a bacteria that we have sometimes in the stomach called H. pylori. And you will see this in the screen, H. pylori. Very easy to test. And if you treat that, and you have this problem and you treat that, the probability of you being able to tolerate the levodopa and absorb the levodopa correctly increase. So it's better you to check for that. The other thing is make sure that you have your glucose, your sugar under control. Because you have diabetes and you don't control the diabetes, there is something that we call in medical term gastroparesis. So basically slowing down the mobility of your stomach. So the absorption, those symptoms of feeling fullness increase. So increase the probability of you not being able to tolerate the levodopa. So very important that you treat diabetes. Have your glucose under control. And especially if you are taking other medication to slow down the digestive tract, like painkillers, narcotics, those medications affect the mobility of the intestine and the stomach. Okay, so very important that you have those factors under control. Step number 4, try Carbidopa levodopa. If you cannot tolerate the IR is the first one that we try, which is the regular one. Typically here in US is I call it the yellow pill because usually it's yellow, but don't worry about the color because color change depend on the country, many other factors. But the immediate release, if you cannot tolerate the short acting, the IR or immediate release, then the next step, step 4, is to try the Carbidopa levodopa 25/100, but this time the ER or extended release or continuous release, which is not actually extended release, a real extended release formulation, but we call it extended release here, formulation, Sinemet. The problem with this type of formulation is that it has a erratic absorption. So you don't absorb the whole thing. You don't absorb like the IR formulation. You absorb approximately 65 to 70% of the pill. So that's an option that you have. But if you have the option of using a real extended release formulation such as Ritari or Crescent, that's the way to go. That's the way to go, because this is a real extended release formulation. And technically, and I have seen that in real life, that patients are able to tolerate better these two formulations, Ritari or Crescent. Crescent is the new formulation approved, I believe, in September last year, 2024, which patients tend to tolerate this medication better. That's another option. Now, step number 5, always treat your anxiety, because if you have this thought about every time that I take this pill make me sick, maybe nauseated, you will have the side effects. And that happen, it's like having a post-traumatic stress disorder. Post-traumatic stress disorder. So you have this very bad side effect, and you are always thinking that this is gonna happen. So if I take this pill, I will get sick, I will get nauseated. It's gonna happen. It's gonna happen. So you need to prepare your mind that hopefully this is not gonna happen to you next time that you take the pill. And if this is causing you significant amount of anxiety, you might need to treat that pharmacologically. So make sure that you treat your anxiety, because your body always follows your state of mind, almost always. Now, imagine that you treat your anxiety, you try the Ritari, you try the Crescent, you before try this ER formulation or the CR formulation, and still you have the problem. So then what you can do? Well, then if you don't have, because you try all the Levodopa formulation that we have orally, then you might need to switch to another type of dopaminergic agent. Remember, the most potent dopaminergic agent that we have available still in 2025 is Levodopa. There is nothing better than Levodopa. Now, if you cannot tolerate Levodopa, then the next option, and there is a few patients, this is very rare that you see this, but you can. I have no more than 5 or 10 patients that they cannot tolerate the Levodopa. So when that happens, again, it's very rare, then you need to use something else, a different dopaminergic agent. And the second most potent, even though that we have more side effect, is the use of dopamine agonist. So, but dopamine agonist could be an option in those cases that you cannot tolerate the levodopa, and you don't have compulsive disorder, and you don't have significant daytime sleepiness. You definitely can consider a dopamine agonist. And I would suggest, if you are going to try dopamine agonist, to use the patch, rotigotine patch, which we call here in US a Nupro patch. By the way, we are waiting for a new dopamine agonist that probably will get approved next year. We'll see what happens. The name is, you will see it in the screen, is tavapadon. Very difficult to pronounce, like always. But that's the new one that apparently is more selective, and because it's more selective and dopamine agonist, it has less side effects. So we'll see. Now, so we talk about medications, right? Let's talk about what happens if you cannot tolerate those medications. You cannot tolerate levodopa. You cannot tolerate dopamine agonist. And then what? What you can do? Well, another option is to try levodopa, but has a supplement. What do I mean with that? So there is something that we call Mucuna pruriens, and you will see that in the screen. And I have a video about Mucuna and what is Mucuna and why we have Mucuna. So Mucuna is actually a bean. So it's a velvet bean. So many years ago in India, people used to treat what we call, or we think is what we call Parkinson's disease, with Mucuna pruriens. So on Mucuna pruriens, the problem is that it's not approved by FDA, so you never know what is there, what actually you are getting in the bottle. So that's the problem. So I cannot tell you to start 3 capsules 3 times a day because there's no way for sure to know how much you are getting in this capsule or this tablet or this pill. There's no way to know. Different from if I prescribe the Sinemet, I know that this 25/100 here, I don't know how much Levodopa is there. I'm not sure. You can see in the bottle it might say 100 milligrams, but you are not sure about that. There's no way. There's no way to be sure about that because it's not regulated. Okay, so what I would suggest is to try the lowest dose possible and try to go up progressively, like in the same way that when you take the Sinemet. So every 1 week or every 2 weeks you increase, and based on your symptoms. If you really have Parkinson's disease, Mucuna should help with the mobility. Remember, you cannot say that Levodopa is not helping you because the tremor doesn't get better. If the tremors do not get better, you still can have Parkinson's disease because tremors sometimes Levodopa doesn't do too much. There are approximately 25%, 20% of the tremors in the setting of Parkinson's disease don't respond to Levodopa, and you still have Parkinson's disease. So don't evaluate the effectiveness of Levodopa based on the tremors. You evaluate the effectiveness of Levodopa based on the stiffness and the slow movements. Okay, so when you are going up with the Mucuna, going back to the Mucuna, when you evaluate Mucuna prurien, the effectiveness, go slow, the lowest dose possible, and increase progressively. And you evaluate how fast you move. Sometimes help with the walking too, sometimes, and the stiffness. If you're having other side effects such as I mentioned initially, dropping blood pressure or feeling sleepy after taking the levodopa, the first thing that you can do is to lower the dose if you can, lower the individual dose, and increase the frequency. That's one option. Second option will be to switch to a long-acting formulation like Ritari or Crescent because the peak dose is less pronounced with those medication, with the Crescent or the Ritari, so you don't have those peak dose that you see with the regular Carbidopa Levodopa, the Sinemet. If you have any other ideas, please share with me in the comments section because I want to know that. Okay, if you have any ideas what you did when you could not tolerate the levodopa, please let me know because I want to learn from you guys too. Okay, if you like this video, don't forget to subscribe to my channel